2002 to 2003 SARS outbreak. In November 2002, a Chinese patient received treatment at the First People's Hospital of Foshan. The man, a farmer from the Guangdong province, later died and no definite diagnosis was made regarding the cause of death. Later that month, an electric warning system from the World Health Organization detected a flu outbreak in China. The system picked up on the epidemic through internet media monitoring and analysis. It wasn't until February 2003 that the People's Republic of China informed the World Health Organization of the viral outbreak. The lack of openness was highly detrimental to global contamination efforts and received international backlash. The Chinese government would ultimately apologize for the delay in dealing with the epidemic. By the time the WHO could take action, there were already more than 500 deaths and 2,000 additional cases reported worldwide. One man was instrumental in raising the alarm and thus triggering a response that would save numerous lives. In February 2003, Italian doctor Carlo Urbani examined a patient named Johnny Chen at a hospital in Hanoi, Vietnam. Chen had developed pneumonia-like symptoms on a flight from China to Singapore. He subsequently died. Urbani knew that he was dealing with a new and dangerously contagious viral disease, so he alerted the WHO. Unfortunately, he would also contract the disease and succumb to it towards the end of March. A month later, the severe acute respiratory syndrome genome was isolated, and the root cause of it was determined to have been a coronavirus strain. In a laboratory setting, macaques reportedly exhibited the same symptoms as humans. The virus was dubbed SARS-CoV, and the WHO declared it contained on July 9, 2003. By that point, SARS had struck 17 countries with 8,098 reported cases and 774 deaths, mostly in Hong Kong and mainland China. However, considering the lack of transparency from the Chinese government, the real death toll may have been much higher. Coronaviruses are a group of viral agents that can cause diseases in birds and mammals. The name corona is derived from the Latin word for crown or halo. It's connected to the characteristic appearance of the virus particles, which bear some similarity to a solar corona or a royal crown. These particles are actually proteins, which populate the surface of the virus and determine the type of host to be infected. The earliest ancestor of the coronavirus can be traced back to about 8,000 BC. The first strains were discovered in the 1960s in chickens, as well as samples from the nasal cavities of human patients who had the common cold. Since then, there have been a total of 7 coronavirus strains identified in humans, the most recent being in 2019. Several of these strains have been in continuous circulation, causing respiratory infections in children and adults. They're believed to be responsible for a significant portion of all the common colds. Additionally, these viruses can cause pneumonia, bronchitis, as well as severe acute respiratory syndrome, or SIRS, and Middle East Respiratory Syndrome, abbreviated as MERS. Some of the diseases associated with coronaviruses in humans, particularly the latter two, can be fatal. Warm-blooded flying vertebrates such as birds and bats appear to be the most ideal hosts for coronaviruses. These viral agents are also known for causing diseases in domesticated pets or farm animals. As of the making of this video, there is global concern regarding a coronavirus outbreak that can be traced back to late 2019. It originated in China in the city of Wuhan, prior to spreading to other cities and regions around the world. The virus is a new strain and is potentially deadly. Number 4. 2012 MERS outbreak. Middle East Respiratory Syndrome, or MERS, is another dangerous infection associated with coronaviruses. It's distinct from SARS and common cold coronaviruses. The strain responsible for causing the disease was identified during the 2012 outbreak. The first confirmed case of MERS was reported in Saudi Arabia, with possible earlier instances in Jordan. Samples of the previously unknown coronavirus, ultimately dubbed MERS-CoV, were gathered from infected lung samples by virologist Ali Mohammed Zaki. The Erasmus Medical Center in Rotterdam subsequently sequenced the virus's genome from the samples that Zaki had sent its staff. The patent for the full genome was thus claimed by Netherlands, which angered Saudi Arabian officials. The doctor was fired from the hospital he'd been working at for bypassing the authorities upon sending the samples. He reportedly claimed the matter had been too urgent for politics. After the virus was identified, a global alert was issued by the World Health Organization. While containment of SARS took place within roughly 6 months, Middle East respiratory syndrome has proven more dangerous and more durable. The mechanism of spreading for MERS-CoV is currently unknown, but it's believed that person-to-person transmission is limited. Sporadic outbreaks and cluster cases have been reported outside of the Arabian Peninsula, most notably in South Korea in 2015. From May to July of that year, 36 people succumbed to the infection, and the authorities initially withheld details about the outbreak from the public. The fatality rate for MERS has been calculated at 36%, the highest of all coronaviruses so far. Between 2012 and 2015, MERS has been reported in over 21 countries with more than 1,000 cases and over 400 deaths. As the name of the respiratory infection would imply, the most affected area so far has been the Middle East. It remains on the World Health Organization list of viruses likely to cause a future epidemic and is therefore targeted for urgent research and development. In 2014, the Corona Map was launched in order to track it in real time across the world. Before human transmission, coronaviruses use animals as intermediate hosts. In most cases, bats have been identified as the most likely natural reservoirs. SARS spread from a food market in China's Guangdong province. It was isolated from masked palm civets, a local delicacy. As a result, more than 10,000 civets were killed in the region. It's strongly believed that SARS-CoV jumped from cave-dwelling horseshoe bats to civets and then mutated to infect the human population. MERS-CoV is also believed to have originated in bats prior to spreading to dromedary camels. In Saudi Arabia and the United Arab Emirates, camel products such as meat or milk are consumed regularly. It's still unclear whether animals are the source for MERS or simply a significant reservoir. Regardless, it's been described as the most likely source of transmission to humans. Once a coronavirus finds a human host, it can then spread via human-to-human transmission by variable mechanisms. The coronavirus that emerged in 2019 appears to be the most contagious of its kind. Number 3. Wuhan coronavirus outbreak. In December 2019, people in Wuhan, the capital city of China's Hebei province, developed pneumonia symptoms that didn't respond to treatment or vaccines. The virus was initially labeled as pneumonia of unknown causes and linked to the Ernan seafood wholesale market. Its natural reservoir is still being debated, with some experts arguing that it originated in bats. One theory is that people first contracted the virus by consuming bat soup. Afterwards, it mutated and human-to-human transmission became its primary form of spreading. The Wuhan Biology Engineering College claims that snakes are the most probable natural reservoirs. As of the making of this video, it is unknown which animal, if any, represents the point of origin. The Chinese government was commended by the WHO and several other countries for providing regular updates and for their efforts in containing the epidemic. The approach was different than the one they'd taken with the SARS outbreak, mentioned earlier on our list. Chinese scientists quickly completed the genetic sequence of the virus and made it available around the world. This also constituted a first step towards the potential development of a vaccine. Wuhan and more than a dozen cities with a combined population of 57 million have been placed on partial or permanent lockdown. This has involved the termination of public transportation and outward travel. A number of countries have put out travel warnings against the Hebei province. Several of the festivities and public events associated with the Chinese New Year were also cancelled. Chinese authorities have been providing clearances for countries looking to evacuate their citizens from the affected areas. Today's topic was requested by Instagram follower @StuartMuir131. If you have any other topics you'd like to learn about, subscribe and let us know in the comments section below or follow us on Instagram and reach out to us there. MERS, SARS, and the 2019 novel coronavirus all start out with flu-like symptoms. These typically include fever, coughing, and breathing difficulties. The mechanism of infection is rather similar as well. These coronaviruses latch onto proteins studding the outside of lung cells. It's this extensive damage to the lungs that makes coronaviruses potentially deadly. In most fatal cases, including those belonging to the latest outbreak, pneumonia and organ failure are among the most common causes. For SARS, the average incubation period is between 4 to 6 days, and MERS usually develops within 14 days. Aside from the aforementioned infection signs, SARS is also associated with lethargy or muscle pain, but the only symptom common to all patients seems to be a fever above 100 degrees Fahrenheit. MERS may also involve vomiting, diarrhea, or coughing with blood. That being said, flu-specific symptoms and others may range across MERS, SARS, as well as the novel coronavirus. In some cases, patients might not exhibit any signs of infection. One dangerous aspect when it comes to highly contagious coronaviruses is the possibility of superspreaders. These are infected individuals that follow the 20-80 rule, with potentially higher or lower variations. This means that 20% of those infected are responsible for 80% of transmissions. In the 2003 SARS epidemic, for example, a doctor had treated patients in Guangdong. Even though he developed symptoms, he traveled to Hong Kong to attend a family wedding. He infected an estimated 16 guests at the hotel he was staying at, who then traveled and spread SARS to Canada, Vietnam, Singapore, and Taiwan. The MERS outbreak in South Korea was traced back to a single businessman who traveled to the Middle East. Number 2. Novel coronavirus 2019. The virus responsible for the 2019-2020 outbreak shares some similarities with previously identified strains, but overall, it's considered new. It's informally referred to as the Wuhan coronavirus and has been designated 2019 nCoV. It has an incubation period of 2 to 14 days when considering the models from previous outbreaks of similar coronaviruses. It remains to be determined if it's contagious during incubation. 2019 nCoV can be transmitted via droplets, breathing, coughing, and direct contact. 3 to 6 feet has been determined as the average range of contamination. It's able to transmit along a chain of at least 4 individuals. Experts warn that it can also spread on contaminated surfaces. Severe infections can result in pneumonia, kidney failure, and death. It's been determined that many of those who died had pre-existing conditions such as hypertension, cardiovascular disease, or diabetes, which weakened their immune systems. The fatality rate as of the making of this video is below 5%, which is lower than SARS and much lower than MERS. However, the outbreak is still ongoing, so the figure might increase. There are also concerns that the Chinese government, although quick to act on the epidemic, hasn't been upfront about its magnitude. There are currently no vaccines, cures, or effective treatments for the most dangerous human coronavirus strains. On a global scale, containment and treatment efforts are still ongoing in the most recent outbreak. Surviving the potentially deadly complications of coronaviruses can be most effectively achieved through prevention. These measures are more or less the same for all coronaviruses. One of the most important preventative steps is to regularly wash your hands with soap and water or alcohol-based solutions. Cover your mouth and nose when coughing or sneezing. Otherwise, make a conscious effort to limit the amount of times you touch your nose, eyes, and mouth. Avoid close contact with people exhibiting symptoms of a respiratory illness. Also, avoid direct contact with animals and surfaces associated with them in live markets. Practice food safety by avoiding meat from unsafe sources and thoroughly cooking animal products. If you've recently traveled to areas known for the presence of 2019 nCoV and suffer the symptoms associated with it, you should contact your healthcare provider immediately. Call ahead if you're going to visit a public hospital and take precautions to avoid spreading the disease in your community. Healthcare workers are at the greatest risk of contracting the disease. They're required to wear full face masks as well as go through several other safety protocols, preferably in accordance to World Health Organization guidelines.
Official They Will Kill You merchandise is now available at theywillkillyou.com. Some of it is to die for.
Number 1 World Reports as of January the 31st, 2020. On January the 30th, 2020, Chinese authorities noted the deadliest day the country has seen since 2019 nCoV first struck. Over 40 deaths were reported in Hebei, the province at the center of the outbreak. The virus has been found in every province of China. As of the making of this video, there have been nearly 24,000 cases of infection reported worldwide in over 25 countries and 500 deaths. The fatal cases thus far have all been recorded on the Chinese mainland. The World Health Organization declared the outbreak a public health emergency of international concern. Numerous organizations around the world are developing vaccines and testing antiviral medication. On January the 31st, the World Health Organization has published an overview regarding estimated time for vaccine development, transmission, incubation time, mortality rate, and reports on how affected countries are containing the spread of 2019 nCoV. Thanks for watching. Be sure to click on one of the links on your screen for more videos.